Video 23, Educational Strategies and Learning Principles, Area 2, CHES Subcompetencies 2.4.3. Review the learning objectives for this video. Now we are going to explore something that will shape how you design every health education program you create, and that is understanding how adults learn differently from children. This is one of the most important distinctions in health education. Pedagogy refers to the art and science of teaching children. In a pedagogical approach, the teacher directs the learning process, the learner plays a dependent role, and the curriculum is organized around subject content. Children are primarily motivated by external factors such as grades, praise, and rewards. Their limited life experience means the teacher serves as the primary source of knowledge. Andragogy, a term popularized by Malcolm Knowles, refers to the art and science of helping adults learn, and here is why this matters so much for your work. In an andragogical approach, adults are self-directed learners who want to take an active role in their education. The curriculum is organized around problems and real-life situations rather than abstract subject areas. Adults are internally motivated, meaning they learn best when they see the direct relevance to their lives, careers, or personal goals. And perhaps most importantly, adults bring a wealth of life experience that serves as a rich resource for learning. This is exactly why health education programs for adults should incorporate discussion, case studies, and experiential activities rather than purely lecture-based instruction. On the Certified Health Education Specialist exam, you may be asked to identify which approach is most appropriate for a given audience or to match characteristics with either pedagogy or andragogy. Remember that Knowles is the name most associated with andragogy. Understanding these principles will make you a more effective educator for every adult audience you work with. Building on the concept of andragogy, let me share with you the key principles of adult learning that every health educator should know and apply. And by the way, think about your own learning experience right now as we go through these, because they apply to you too. The first principle is that adults need to know why they are learning something before they invest effort. Always begin a session by explaining how the content connects to their health, their families, or their daily lives. The second principle is that adults learn best through experience and hands-on application. Lectures alone are not effective. Incorporate role-playing, demonstrations, return demonstrations, and practice opportunities. The third principle is that adults approach learning as problem-solving. Frame health education content around real problems and practical situations rather than abstract theory. For example, instead of teaching nutrition science in isolation, present a scenario about managing diabetes through dietary changes. The fourth principle is that adults are motivated by relevance. If they cannot see how the information applies to their situation, they will disengage. Always connect content to their immediate needs and concerns. The fifth principle is that adults need respect and autonomy. They do not respond well to being talked down to or treated like children. Honor their existing knowledge and experience. And the sixth principle is that adults learn best in a supportive, non-threatening environment where they feel safe to ask questions and make mistakes. On the exam, you may be asked to identify which strategy best reflects adult learning principles. Look for options that emphasize self-direction, relevance, experience, and problem solving. These principles are not just exam content. They are the foundation of everything you will do as a health educator working with adult populations. Now let me help you build your toolkit of educational strategies, because knowing which strategy to use and when is what sets great health educators apart. Health educators have a range of educational strategies to choose from, and selecting the right one depends on the learning objectives, the audience, and the context. Lecture is the most efficient strategy for delivering information to large groups, but it offers limited engagement and is the least effective for behavior change on its own. It works best when combined with other strategies. Discussion promotes critical thinking and peer learning. It is particularly effective with adults because it draws on their life experience and encourages active participation. Small group discussions, guided by structured questions, can be powerful learning tools. Demonstration involves the educator modeling a skill or procedure for learners to observe. This is followed by return demonstration, where participants practice the skill themselves. This approach is ideal for teaching physical skills like blood pressure monitoring or proper hand washing technique. Role playing allows participants to practice real world scenarios in a safe environment. It is particularly useful for building communication skills, such as practicing how to negotiate condom use or how to refuse peer pressure to use tobacco. Case studies present realistic scenarios that require learners to analyze information, identify problems, and propose solutions. This strategy develops higher order thinking skills and mirrors real world decision making, and simulation provides an immersive practice environment where learners can experience realistic situations without real world consequences. On the exam, match the strategy to the objective. If the objective involves knowledge, lecture or discussion may suffice. If it involves skills, demonstration or simulation is more appropriate. You now have a wonderful range of strategies to draw from, and knowing how to match them to your objectives is going to make your programs truly effective. Read the scenario stem aloud. Give students 30 seconds to consider options before advancing. The correct answer is B. Older adults are adult learners who benefit from andragogical principles, including hands-on experience, problem-centered learning, and relevance to daily life. Hands-on balance exercises and real-life scenarios directly apply adult learning principles. A pedagogical lecture approach, textbook assignments, and purely online modules do not adequately address the self-directed, experiential needs of adult learners. Summarize the key takeaways before